She also lives with a long-term health condition. Before I call her here, we have got a group of patients who are very kindly have come to support us here. Can I ask them to stand, please? The patient group who have come from Wandsworth. I thank you very much indeed for taking this. Hello. Please welcome.
Good evening, ladies and gentlemen. It is an honor to be standing here today to represent the patient. I have, as Zafar has just said, got a group of patients here with me today. And I have worked with them, and we've had a focus group with my local NHS, that's Wandsworth CCG. They have had experiences both episodic and ongoing with the healthcare system. And together, we talked about what the experiences that each of them had. So what I've done for you today is I've put this together to tell you a story about M, so that I can illustrate the experiences that they've had. M is looking back to when this all started, when she started feeling unwell. She took some over-the-counter treatments and got better. However, of late, things aren't getting better, so she decides she needs to go and see a professional. She calls and books an appointment at her surgery, and she's told that since it's not an emergency, she needs to call at 9 a.m. on Monday morning to see if she can book an appointment for that week. She does that, goes and sees the doctor. The doctor is extremely understanding, listens to her, tells her that she's going to have to do a couple of things. Have some blood tests, go and see a specialist, and gives her some medication that she can use in the meanwhile to alleviate her symptoms. She takes the blood test form. It says she can go to Center X or Hospital Y to have this blood test. And she goes to the pharmacy to buy her prescription medicines. She gets them, goes to work, calls Center X and Hospital Y and realizes that the working hours means she's going to have to take some time off from work to go and have this blood test. She does that. Waits for the letter from the hospital because they couldn't do it on the day. The children's book system was down. Over the next few months, she sees various people, she has a lot of tests, and finally she's diagnosed with a long-term health condition. The consultant tells her it's probably something that she's going to have medication for the rest of her life. She's going to have blood tests, and she's going to have regular checkups. M leaves the consultant's office. She's feeling a little overwhelmed, and she's a bit unsure about what the implications of her diagnosis are. She starts thinking, maybe I should have asked some more questions. Maybe I should have asked for something in writing. What does this diagnosis really mean for me? Do I really have to take all these medicines? Will I be able to continue to work? And then she starts asking herself, why me? Why did this happen to me? She leaves the hospital a little dazed and realizes that though the world around her stayed the same, her life's turned upside down. At the pharmacy where she goes to fill her prescription, the pharmacist kindly tells her that one of those medicines that she's being prescribed is actually cheaper over the counter, so she might like to buy it over the counter. She does that. She goes home. She reads all the patient information leaflets on that group of medicines and starts getting a little worried and a little concerned. But she decides to trust the system and the people who prescribed it and plows on. A few months later, she's sure she's getting better. She might be having a few side effects. She has her regular blood tests and her checkups. And because her prescription is for 28 days, every 25 days she makes this journey to the surgery, puts in her repeat prescription request, goes back 48 hours later, collects it, takes it to the pharmacy, gets it filled in, and then realizes one of those medicines is not available, so she's going to get an owing slip and she has to come back again. She finds that the distraction of work is really good. It helps to pay for all the travel and the medication she now has to have. However, she finds that she spends a lot of time waiting for appointments, rearranging her appointments,